Ovarian cancer, often called the silent killer, is one of the most dangerous cancers in women because its symptoms are subtle, vague, and easily mistaken for common digestive or menstrual problems, which means many women do not recognize the warning signs until the disease has already reached an advanced stage. In fact, ovarian cancer originates in the ovaries or the fallopian tubes, and, unlike breast or cervical cancer, there is currently no routine screening test for the general population, making self-awareness of early symptoms absolutely critical. Yet studies show that women often ignore or misinterpret these early signs, attributing them to aging, hormonal changes, stress, or diet. The earliest warning signs can include persistent bloating or abdominal swelling that lasts for more than a couple of weeks, even without major changes in eating habits. Because tumors in or near the ovaries can irritate the abdominal lining and cause fluid buildup, giving a full or distended belly feeling. Another common overlooked symptom is pelvic or lower abdominal pain or pressure, which may come and go but tends to gradually worsen over time, often dismissed as menstrual cramps, urinary tract issues, or back strain. Changes in appetite, such as feeling full quickly even after eating a small amount, unexplained weight loss or weight gain, and nausea or indigestion can also occur because the growing tumor presses against the stomach and intestines. Frequent or urgent urination without infection is another silent sign, caused by the tumor pressing on the bladder, yet many women think it's just a bladder infection or part of aging. Some women may also experience unusual fatigue, unexplained lower back pain, constipation, changes in bowel habits, or menstrual cycle changes, including heavier, lighter, or irregular bleeding, and in some cases, pain during intercourse, which they may avoid mentioning to their doctor out of embarrassment. Medically, these symptoms happen because ovarian cancer often spreads within the pelvis and abdomen before being detected, and early-stage ovarian cancer rarely causes severe pain or dramatic symptoms, so the disease advances quietly. Risk factors that increase the likelihood of developing ovarian cancer include family history of ovarian or breast cancer, especially with BRCA1 or BRCA2 gene mutations. Personal history of certain cancers, increasing age, most cases occur after menopause, endometriosis, obesity, long-term hormone replacement therapy, and never having been pregnant. While these factors do not guarantee cancer, women at higher risk should be especially alert to subtle bodily changes because ovarian cancer symptoms overlap with those of gastrointestinal, urinary, or gynecological conditions. It is important for women to track the frequency and persistence of symptoms. Experts recommend that if any of these warning signs occur more than 12 times in a month and persist for more than 2 to 3 weeks, a medical evaluation should be sought immediately. Diagnosis often involves pelvic examination, transvaginal ultrasound, and blood tests such as CA-125, a protein that can be elevated in ovarian cancer. Although CA-125 is not specific and can rise with benign conditions, if cancer is suspected, imaging tests and sometimes surgical exploration are used for confirmation. Early detection dramatically improves survival rates. When found in stage I, the 5-year survival rate can exceed 90%. But because most cases are found at stage 3 or later, the average survival rate drops significantly, which is why awareness of these silent signs can save lives. Prevention strategies focus on managing risk factors. While you can't change genetics or age, lifestyle modifications like maintaining a healthy weight, regular exercise, and avoiding unnecessary hormone therapy can help. And women with a strong family history may consider genetic counseling, regular monitoring, or even preventive surgery. From a public health perspective, breaking the silence around ovarian cancer is crucial because too many women assume their mild bloating, back pain, or bathroom habit changes are harmless or just normal for my age, delaying diagnosis and allowing the disease to spread. By openly discussing these subtle but persistent symptoms and encouraging women to seek medical advice when they occur, especially if they are new or unusual for the individual, we can catch more cases earlier and improve outcomes. Ultimately, the key message is that ovarian cancer is not truly silent. Our bodies do send warning signals, but they whisper rather than shout. And it is only when we learn to listen carefully to these whispers that we can stop this silent killer before it strikes too hard.